Okay, so we're going to go ahead and get started. So, welcome everybody. Thank you for joining us today. My name is Mel Umbarger, and I am the Director of Communications for the North Carolina Budget and Tax Center. With the last week's federal actions, it's more important than ever that North Carolina lawmakers take steps to try and mitigate the looming harms of the federal cuts to the folks in North Carolina. So we've gathered some folks here together today to discuss how this will affect the people of North Carolina, what options lawmakers have to meet this moment with a bold and responsible plan, one that puts people over profits and charts a path ahead through the challenges coming up. So just to give you a quick run of show, we have a few speakers here that I'll introduce. They're each going to take about 3 to 5 minutes to talk about things from their point of view. And then around 10:25, we'll hopefully finish that up and have a Q&A where everybody can ask questions that you might have about this or any of the other federal tax or federal cuts or budget things that have come up in North Carolina recently. Feel free to record. We're also going to send a follow-up email after this with a link to the recording that you can use however you need to, as well as hopefully a transcript if everything works out. So with that, I'm going to introduce our first speaker. This is Alexandra Sirota, who is the Executive Director of the North Carolina Budget and Tax Center.
Morning, everyone. It's great to be with you. And this is, as Morris said, a critical conversation that we're having. My name is Alexandra Sirota, as Mel said, and I'm the Executive Director of the North Carolina Budget and Tax Center. As you all know, North Carolina policymakers have gone home to their communities without passing a state budget, despite mounting needs and a deepening funding crisis. By all accounts, the House and Senate are at odds over how to handle official revenue projections that show quite clearly income tax cuts will reduce the funding necessary to keep up with ongoing needs. The budget proposals presented by the House and Senate in North Carolina took only slightly different approaches to the personal income tax cuts scheduled through 2030, and both would continue the elimination of the corporate income tax. Households in the worst paid 20% of the distribution, those with incomes less than $25,000 a year, would fare particularly poorly under the House and Senate tax plans, seeing a break of just $75 and $5 a year, respectively, while the richest 1% of North Carolinians would receive an additional $3,000 in annual tax cuts on top of more than a decade of breaks received as state budget writers have marched the flat personal income tax to zero. Even before the federal budget bill passed, North Carolina already lacked the public funds needed to meet essential needs and respond to threats to community well-being. More than a decade of tax cuts in North Carolina for corporations and the wealthiest few has left people in communities at greater risk of harm from flooding and storms, struggling to afford or access childcare so that parents can go to work, and many families across the state, the vast majority of North Carolina's children, are faced with an unconstitutionally underfunded public school system. These are the pre-existing risks and barriers to opportunity and well-being that showed the inadequacy of legislative budget proposals before last week. But the latest federal actions, which slash healthcare and food assistance to pay for even more tax cuts for the ultra wealthy at the federal level, only raise the stakes. These developments make the state's current budget proposals on the table wholly inadequate and frankly obsolete. Now is the time for elected leaders to get back to work, not just to pass a budget, but to put forward a new responsible plan for how we come together to meet this moment and care for each other. That means making sure that our public institutions can stabilize our communities and reduce hardship. Without serious commitment to considering the implications of federal cost shifts and funding chaos, state budget writers are fueling greater uncertainty for families and communities when certainty is desperately needed. For too long, North Carolina budget writers have treated tax cuts for the wealthy and for corporations as the default, squeezing public services and shifting costs onto families and communities in the process. North Carolinians reject that approach. They want a budget that puts people first, that funds childcare, education, healthcare, and support for the small businesses in every community across the state, not just corporate tax breaks. The good news is that we know what can be done and what is needed. North Carolina budget writers must immediately stop the elimination of the corporate income tax, implement a millionaire's tax, and keep the personal income tax rate at 4.25% for incomes under $1 million. These are just first steps to fix our tax code so that it can meet this moment for all North Carolinians and provide the funding necessary to minimize healthcare coverage losses, hunger, and hardship from federal cuts. But we should be clear that more will be needed. And budget writers have the power and ultimately will be responsible for the care to North Carolinians who fuel the well-being of our communities and economy going forward. When lawmakers ask millionaires and corporations to pay what they truly owe through taxes, our state will be able to create a foundation that ensures all North Carolinians have the opportunity to thrive. Thank you.
Thank you, Alexandra. Next, we have some remarks from Monica Lavery, a retired clinical social work supervisor and a member of the Patriotic Millionaires. Thank you.
Good morning. I'm Monica Lavery, and I am a fairly new member of Patriotic Millionaires. I've just retired to the far northwest corner of our state in Ashe County, where there's a shortage not only of doctors, but skilled trade professionals. So thanks for moving me to first, because when the plumber says they're coming at a certain time, you say, yes, sir, I'll be here. I'll also briefly explain why my husband, John, isn't on the call. I speak for both of us due to some disabilities he has related to an acquired brain injury. I am a licensed clinical social worker, a retired trauma therapist, and clinical supervisor, and I've worked in both the private and public sectors in North Carolina. John is a mathematician who managed programs in advanced mathematical and computational research for the armed forces for decades. My husband and I have been in the top 1% to 2% of earners in North Carolina since settling here in 1995. Now, our wealth does come from work and investment, but also inheritances. In our parents' generation, they were able to buy real estate, buy homes, and then we ended up with inheritances from some of that. And our background as children of the professional class gave us a real leg up in our economy. And now in retirement, we are still in top 1%. For years, we watched our wealth accumulate via investment income and generous pensions, and our taxes remain minuscule. Our federal taxes remain very low, mostly because we can take advantage of a tax code that's been designed to benefit the wealthy through deductions, incentives, and exclusions that most working people, they just don't apply to them, especially if they can't afford to purchase a home. At the same time, the income of regular working people has stagnated and their job benefits have disappeared. At tax time nearly every year, John and I look at each other and have the same conversation. Why don't our lawmakers raise our taxes? Why don't they fix the tax code to benefit everybody and not just us? The state should collect and invest much more revenue in the other 99% of North Carolina taxpayers. Having raised 4 children in our wonderful state, it is heartbreaking for us to see how hard basic survival has become for working parents. Keeping a flat income tax will never close the gap between what the people of our state need and what the state can afford. I just mentioned that our daughter is a very gifted teacher, and she tried being a teacher for nearly a year in North Carolina and found that she just couldn't make it between considering the low salary, and then on top of that, the long hours and all of the supplies that she had to buy, because neither the schools nor the parents were capable of providing those things. She really just couldn't make it, so she's moved out of state. The U.S. Congress and the NC state legislature should raise taxes on 1%ers like us and invest that revenue in affordable infrastructure for every working family. We would gladly pay a higher tax rate so our children and their Gen Z peers can afford to stay here and have hopes of someday being able to purchase a home and raise a family. But our state and federal government policies seem to be working against that for this vision for future generations. We want revenue to provide infrastructure for healthcare, childcare, education, and housing. And as patriotic millionaires and proud North Carolinians, we want to pay our fair share. Thanks.
Thank you, Monica, for sharing your experiences and your thoughts. And if you need to run to deal with plumbers, I understand. All right, so now we are going to hear from Miles Trinidad, a state analyst with the Institute of Taxation and Economic Policy.
Thanks, Mel. Like you said, I'm Miles Trinidad. I'm a state policy analyst at the ITEP, and I focus on the state of North Carolina. For background, in ITEP is a nonprofit research group. We're focused on state, local, and federal tax policy issues, with a particular focus and emphasis on equity and sustainability. In the context of North Carolina, when people are asked to think of a fair tax code, most people want to point to a regressive tax code where the wealthiest are asked to pay a lower share of their income towards taxes than those who are low and middle income households. However, this is the case in North Carolina. Our organization puts out a 50 states analysis comparing every other state and what's the most regressive, least regressive. And North Carolina is squarely regressive and is the 24th most regressive state in our report. The top 1% of households pay about 6% of their income towards state and local taxes, while the lowest 20% pay about 10.5% of their income towards taxes. And put more simply, the wealthiest North Carolinians are paying a lower share of their income towards taxes than teachers, firefighters, public safety officers, and factory and farm workers. And this skew towards the wealthy isn't a coincidence. For over a decade, since 2013, North Carolina lawmakers have prioritized tax cuts for the rich while underfunding important needs like education, infrastructure, and more recently, recovery efforts for disaster-stricken communities. And despite all that, the North Carolina General Assembly is proposing more tax cuts that ignore the core needs of North Carolinians in favor of the wealthy. So back in 2013, the graduate income tax was at 7.75%. And since then, the legislature has hacked it away at both the personal and corporate income taxes, going so far as to fully eliminate the corporate income tax by 2030. This has created a massive windfall to large corporations and the wealthy. And also the state has transitioned to a flat tax that will drop to 3.99% in 2026 and 2.49% in 2029. And the cuts to the personal income taxes alone are expected to exceed $14 billion in foregone revenue, with the benefits overwhelmingly going to the rich. ITEP has done an analysis looking at this, and the benefits overwhelmingly go towards the wealthiest. For the personal income tax cuts, about 64% of the total tax cuts have gone to the top 20% of households earning over $140,000 annually. And for the top 1%, those who earn about $867,000 per year will receive about 18% of the tax cuts. In regard to the state's corporate tax cuts, the state's poised to lose about $3 billion in annual revenue once it's fully phased out by 2030. And these tax cuts also, uniquely disproportionately benefit corporate shareholders, which is the group that is wealthier than average and also tends to be residents who live outside of the state of North Carolina. And these residents are poised to receive about 94% of the total tax cut. And in addition to that skewing towards those who live out of state, these corporate tax cuts help big companies at the expense of small and medium-sized businesses, which aren't, in a situation which aren't structured to take advantage of corporate tax cuts. So these small and medium businesses will be put at a disadvantage as, major corporations can, zero out their tax bills. And as the wealthiest North Carolinians continue to benefit from these existing and scheduled tax cuts that have been ongoing since 2013, both the House and the Senate budget proposals are doubling down on these skewed policies towards the wealthiest. I think for the House and the Senate proposals, the wealthiest are set to receive about $25,000 to $32,000 respectively for the richest 1% in the state. Meanwhile, households earning less than $25,000, they would just receive a meager $250 from the House and $44 from the Senate. So North Carolina lawmakers should, stop handing these tax cuts to the wealthiest and focus on shoring up public services, the needs and basic needs that the constituents need, and as well as improving things that have been chronically underfunded in the state. and things they keep saying they don't have money for, while they've lost about $14 billion. Thank you.
Thank you, Miles. Now we're going to hear from Meg Wiehe, the Vice President for State Fiscal Policy and Communications with the National Group Center on Budget and Policy Priorities, or CBPP. Thanks, Meg.
Yeah, thanks, Mel. It's nice to be here with you all. And I'll just say up top, in addition to working at the Center on Budget Policy Priorities, I'm also a Durham, North Carolina resident, and have been a North Carolina resident pretty much my whole life. So really happy to be here with you all. In my role at the center, I support state and federal policy, but as you can probably imagine, over the past several months, I've been pretty hyper engaged in the federal budget debate. That just, at least a part of it, came to a close last week, and that's largely what I want to focus on here. The Republican budget reconciliation bill that was signed into law by President Trump on July 4th will raise cost on North Carolina families and take health coverage, food assistance, and other essentials away from North Carolinians who are already struggling to make ends meet, all while showering ever larger tax breaks on the wealthiest households. ITEP, the organization that Miles works for, did an analysis and found that the richest 1% of North Carolinians will get an average tax cut of more than $61,000 a year, and collectively see a reduction in federal taxes next year of more than $3.5 billion. The bill makes enormous cuts to food assistance and healthcare, in part by shifting dramatic new cost onto states and localities, including requiring states for the very first time to pay a portion of SNAP benefit costs, that's food assistance, implementing new forms of red tape that will increase uncompensated care cost, and restricting how states can fund their Medicaid programs. There are many indirect impacts as well from the bill, including the economic and humanitarian toll of mass deportation. States must balance their budgets each year, which means policymakers have to make hard trade-offs, either raise enough new revenue to fully bridge the gap, or make harmful cuts to healthcare, food assistance, and other services funded at the state and local level, like schools and infrastructure. That would be true even in good times, but is especially true now considering that state revenues have been moderating, and many states are seeing shortfalls, including here in North Carolina, where revenues are expected to drop in the midterm and are further threatened by scheduled personal income tax cuts and corporate income tax elimination. I'm going to share a little bit more details about how the federal reconciliation bill is going to impact North Carolina, but I want to pause first just to be clear that reconciliation is not the only federal policy change that's threatening and impacting states and localities' abilities to provide for their people and communities. There's been a cascading impact of federal policies, frankly, from day one of the Trump administration, including the job layoffs fueled by DOGE, which, by the way, the Supreme Court yesterday cleared the way for those mass firings and restructuring at federal agencies, the canceling and freezing of already appropriated funds, including the most recent pause of more than $7 billion in federal education funding. That's more than $180 million in North Carolina alone. Threats to shift the responsibility for responding to natural disasters solely to states, anti-immigrant DEI executive actions and attacks, and potential for more cuts coming from the federal budget process, and promises for additional executive actions. It's clear to me that state policymakers, need to start planning right away for how to deal with these impacts. And North Carolina lawmakers should absolutely factor the federal policy impacts into their ongoing budget debate. So just a bit more about reconciliation and the impact on the state. I mentioned that for the first time ever, states will be required to pay some amount of SNAP food benefit cost. In North Carolina, that could be up to more than $438 million a year in new cost annually, just to cover and ensure that the 1.4 million people receiving food assistance continue to receive that assistance. If the state can't or won't meet this unfunded mandate, then lawmakers would have to reduce the state's cost by either cutting eligibility or benefits. It's also the case that we could see states opt out entirely from food assistance programs, which would leave 1.4 million North Carolinians, including more than 600,000 children, without the food assistance they need to buy groceries. And it would also negatively impact grocers and farmers, especially in rural communities. On top of that, North Carolina is also going to have to pay around $100 million annually in additional cost to administer SNAP, which will fall most heavily on local governments. There are other changes to SNAP, including really harsh new work requirements that will also leave many more hundreds of thousands of North Carolinians at risk of losing some food assistance. And there'll be an additional cost to the state to figure out how to administer the new red tape with the additional work requirements on SNAP. Then thinking about healthcare, the cuts to healthcare go beyond Medicaid. There were major changes made to Medicaid and to the affordable healthcare that people buy off of the marketplace. All told, by 2034, more than 600 North Carolinians, including children, people with disabilities, veterans, and many others, could lose their health coverage and become uninsured as a result of the Republican reconciliation bill. That's in part due to, again, also like with SNAP, harsh new work requirements that are being put in place, which again, like SNAP, will also bring an additional cost to the state of North Carolina to implement those work requirements. Additional out-of-pocket cost for people with Medicaid and affordable care coverage. And the bill failed to stop premium spikes for people, again, with that affordable healthcare marketplace coverage. I think there's been a lot of attention in North Carolina to the rural hospital closures that are at stake. There's another major risk in this bill that I think hasn't gotten as much attention, which is that the state's Medicaid expansion population could see an immediate end to the coverage for the more than 670,000 North Carolinians who currently benefit under Medicaid expansion because of a provision that was included in the final bill that cuts federal funding that states receive for emergency services provided to individuals who would qualify for Medicaid expansion if not for their immigration status. There is a lot of thinking that this reduction could trigger the North Carolina state law. The state law exists in 9 other states that could end the Medicaid expansion and again impact immediately more than 670,000 North Carolinians Medicaid coverage. And it's also the case that widespread coverage losses could generate significant indirect costs for states and localities as people are stripped of affordable coverage, have to forego routine or preventative care, and later show up at emergency rooms and clinics requiring uncompensated care. Additionally, some of the federal tax cuts that we talked about at the top could flow to North Carolina. Thankfully, the state does not automatically couple to federal tax changes, but state lawmakers here absolutely need to resist the urge to adopt any of the new tax cuts, especially given the dire need for revenue in the state. And there's just a host of other federal policy choices, again, in reconciliation and outside of it, that'll put our economy at greater risk of slowdown, in addition to making people sicker and hungrier, like blocking efforts to transition to cleaner energy. Now, to try and mitigate the damage, states, including North Carolina, should start working immediately to identify additional revenue streams and avoid taking a cuts-first approach. That's especially true for some of the most costly items that won't take full effect for another couple of years, which gives states some time to plan. In North Carolina, this should include pausing or even reversing already planned personal and corporate income tax cuts, revisiting the costly universal private voucher school program, in addition to seeking new revenue sources like a millionaire's tax. Lawmakers here should also reconsider placing a constitutional amendment on the 2026 ballot that would further restrict the state's ability to raise revenue in the future. North Carolina can and should revisit its current budget debate in light of these federal actions. And it is the case that a number of states are considering special sessions in the coming months to tackle the impacts of federal actions and plan forward. To be clear, the trade-offs here are real and long-term. If North Carolina cannot or will not find the resources to backfill the federal cuts, people will lose access to health care and food assistance. And if North Carolina lawmakers choose to cut other spending like education or transportation to offset cuts to health care and food assistance, communities and people here will be left worse off.
Thank you, Meg. Finally, we have some remarks from Morris Pearl, who is the board chair of the Patriotic Millionaires and a former managing director at BlackRock. Thank you, Morris.
Hi, good morning. My name is Morris Pearl, and I'm the board chair at Patriotic Millionaires. We're a group of wealthy Americans, business people and investors fighting against the destabilizing concentration of wealth and power in the United States. We call ourselves Patriotic Millionaires because we're putting our time, our energy, and our resources into an economic justice campaign to fix the country we love and allow us to financially succeed. We are concerned the gap between the rich and the poor has grown so large has created a degree of political unrest that threatens the existence of our democracy. We became Patriotic Millionaires because we're concerned for our country, and it's our patriotic duty to be part of the solution. Gross inequality is bad, not just for the millions of working people in places like North Carolina, but for rich people like me too. And it's those who can afford the most, that is, millionaires like us, who should be paying more to finance what the people of North Carolina need, their health care and their education, not working people who are 2 missed paychecks away from poverty. Earlier this year, our organization introduced the Money Agenda, America 250, with 4 legislative ideas that would mitigate the destabilizing levels of inequality and concentrated wealth that's threatening our country today. One of those involves shifting responsibility from people who work for a living to the millionaire class through a millionaire surtax, which puts the burden on the wealthy, which is where it should have been all along. That will ensure that people who make less than the cost of living in North Carolina do not need to pay taxes. The government should not be taxing people into poverty. Simply said, someone has to pick up the tab in North Carolina for public schools, public roads, hospitals, and all the other things that the people of North Carolina need. And that someone should be millionaires like me. Taxing rich folks like me is a common sense solution, and we cannot continue to create carve-outs for those who make the most at the expense of those who make the least. For lawmakers to write a tax law where a North Carolina corporation like Lowe's, for example, which made close to $8 billion last year, pays 0 in taxes, while a worker who makes less than $8 an hour is still required to pay taxes, that does not make sense. If Tar Heels don't make enough money to live on, then North Carolina will be on the road to the wrong kind of economy. A sales tax dependent system will take more money out of the pockets of people who work for a living, while high earning people pay sales tax on only a fraction of their income. The economy runs primarily on consumer demand. That is, people buying goods and services. If you want to give tax breaks to grow the economy, you should give them to working people who actually spend their savings on Main Street, creating jobs and benefiting everyone. Wealthy people like me are not going to go on strike and stop being rich simply because they don't want to pay too much taxes. Believe me, they like it too much to give it up. And contrary to popular belief, we will not be leaving the country or moving to a different state or flying off to Mars. And we also will not stop investing. The last time I checked, even if tax rates are very high, the returns are still better than what we get from putting our money under our mattresses. We can be part of the solution in stabilizing the economic lives of people who work for a living and stimulating widespread economic growth, but only if we pay our fair share. Thank you for your time. I look forward to working with my colleagues here today to make North Carolina a champion for working people. Thank you.
Thank you, Morris, and thank you to all of our speakers today. I am now going to open up the floor for questions. All right, so I have a question here in the Q&A from Kenneth Lee. With the big, beautiful bill passing, what do you all expect the impact to be for nonprofits in North Carolina? And that's Kenneth Lee with WFAE 90.7 in Charlotte. Say, Alexandra, do you want to?
I can start on this. Thanks for the question. I think, as we begin to dig in, as Meg mentioned, to the many dimensions in that bill, I think the one thing that we know for certain is that North Carolina's nonprofits are overwhelmed already with significant hardship in their communities, particularly nonprofits that are serving people meals, making sure people are connected to housing, making sure that people have educational opportunities. And so with the passage of this bill, we expect that nonprofits will be asked to do more. But unfortunately, what we know is that many nonprofits will not have the additional resources and support to meet that need. We know that many nonprofits are engaged with federal contracts and state contracts to deliver services, and that those funding freezes that Meg mentioned are impacting nonprofits' bottom lines right now. So we expect that nonprofits will be hard pressed to deal with the increased demand for their services. And it really, I think, speaks to the need for public commitment to caring for our neighbors, to making sure that we have a foundation in place so that no person falls into deeper hardship in our communities. That is a public commitment that our leaders can make, and it's one that they should make immediately.
Thanks, Alexandra. Did that answer your question, or do you have a follow-up? Thank you. Okay, so we have another question in the Q&A from an anonymous attendee. How many millionaires are there in North Carolina? Alexandra, do you have that number?
I don't think we have a number. I would turn to Miles to see if Miles has better data on that.
Yeah. So for that one, we kind of look towards the IRS historic table 2 for their SOI income data. So I just pulled it up really quickly. I think in 2022, this is just based on adjusted gross income. So there's all those things that change income. But according to the IRS data, there's about 19,000 people or 19,000 returns, I should say, that have an adjusted gross income greater than $1 million. So a very small percentage of the people who live in the state.
Oh, and we have a comment in here from Jacob Brooks, who is with Patriotic Millionaires. See, in 2020, there were 224,000 millionaire households in North Carolina. Thank you for providing that, Jacob. And if you want to put a link in there too to the source, that would be helpful. Oh, we have a question here from Justin Laidlaw. I hope I said that right. Where should North Carolina residents be spending their money and investing their resources to support one another in these uncertain times? Does anybody want to jump on that one?
I think one thing we've learned over the past this past year is that spending some of your time, resource, energy in changing the policies of your government, as we're trying to do, is a pretty important thing to do.
Thank you, Morris. Alexandra, I see you come off mute.
Sure. I mean, I think one thing we know right now is that across North Carolina, there are a number of small businesses that are going to be destabilized by the policy choices that are being made. As Meg mentioned, the cuts to food assistance are going to impact grocers in primarily rural communities. The healthcare system is at risk with the loss of Medicaid funding. And so I think one thing that North Carolinians can do in this moment is to connect locally with the businesses that are operating in their communities, to spend their dollars locally, to make sure that they're making connections between how their dollars are spent and the jobs in their local community. Those are important near-term steps. But again, to Morris's point, I think the work that every North Carolinian needs to be engaged in this moment is being clear with our state budget writers that we need policies in place that protect the well-being of every North Carolinian. And that means making sure our tax code asks millionaires and profitable corporations to pay what they owe in taxes.
Thank you, Alexandra. We have another question from Sarah Mitchells. Have you all had conversations with North Carolina lawmakers about how you believe they should respond to the federal budget? And if so, how have those gone?
I can take that one. So yes, we've early on in this process of reconciliation begin engaging with state lawmakers, both in the legislature, the governor's office, and state agencies, frankly, to understand and to make clear what's at stake in the reconciliation proposals and the need to plan. I think we've been very disappointed that there has not been significant coordination to be clear about what the long-term plan is, to be clear about what North Carolina needs to do to protect services and programs in our communities. There is certainly a lot of chaos in the funding landscape over the past 6 months. But now that we have a clear picture through the reconciliation bill of what exactly is happening to North Carolina, we hope that state lawmakers will take it seriously, that this is something now we know what we need to prepare for, and our leaders will be responsible for putting together the plan that minimizes harm in our communities. So to date, we haven't seen a real focus on the need to plan from the state legislature, and we're very concerned that unless they begin to put in place thoughtful plans and pause future scheduled rate reductions, we will not be able to minimize some pretty significant harm to communities and families across our state.
Thanks, Alexandra. We have a question from Hope Zhu, and I apologize if I'm getting anybody's name pronounced wrong. Congress has approved significant cuts to Medicaid. While these cuts are not exclusively targeted at individuals with disabilities, in what way might they shrink services for this population in North Carolina, especially with the work requirement?
Do you want me to take that, Alexandra? Sure. I think there are a couple of, there are a number of risks, right? One is certainly the way that the work requirement will work once implemented is it'll be incredibly onerous on the individual to report. And I think so a lot of the concern for people losing coverage is people who are actually working. Maybe they're working part-time or they're working seasonal jobs or going from job to job, will end up losing their Medicaid coverage because of the onerous reporting requirements and all of the additional red tape. So it is going to be absolutely, I did not say this, but absolutely critical for North Carolina. Another thing that lawmakers should start thinking about today is setting up a reporting system that is has no barrier, super easy to use, and ensures that every single working person is able to receive Medicaid, and that they're not losing health coverage just because we have a system in place that makes it hard to access. So that's one. I mean, another is I mentioned, I think it's been pretty well covered here, but there's a real threat to our entire healthcare system from the cuts, not just to Medicaid, but also to the Affordable Care Act in this bill. So it's very possible that we could see clinics close, rural hospitals close, people could lose their access, depending on where they live, to healthcare altogether. And then the third piece, which there's more, just to stop at this third piece, is that I think there is a lot of concern about the interpretation of that emergency, the cut to the emergency healthcare piece, and how that may or may not impact the trigger law in North Carolina, meaning that every single, over 670,000 people in the state who are receiving Medicaid through Medicaid expansion could lose coverage immediately, not just when the other provisions take place. Alexandra, anything else you want to add there?
Yeah, I would just add one thing at the state level to think about is as state budget writers face these impossible math problems that are created because of the income tax cuts, literally every service and program in the state will be on the table in some way for consideration for cuts. And one thing that we know in the Medicaid program is that oftentimes state legislators have looked at services that have been considered optional under federal law, but we know are essential to the health and well-being of people across the state. And those services being put on the table and for potential cuts or consideration for reductions in eligibility would absolutely affect likely disproportionately people with pre-existing conditions, disabilities. And so again, there is a solution here to minimize that harm. Unfortunately, the depth of the cuts at the federal level and the cost shifts can't be completely undone, but North Carolina lawmakers have a responsibility to minimize the harm and to protect North Carolinians who are most at risk of facing deeper hardship and deeper harm to their health and well-being.
Thank you, Alexandra. We have a question in the chat from Pierre Hollis. How aware is the everyday person in North Carolina aware about what's going to happen?
I can try and answer that. It's a tough question to answer. We know from polling that when people hear the details of the reconciliation bill, they oppose it in strong numbers. We don't have a survey of North Carolinians in terms of level of understanding, but what we do know is that in record numbers over the past few months, people have shown up in their communities to push back against the cuts being proposed. They have called their lawmakers in record numbers, and in our work in conversation with communities, we have unfortunately found that there are a lot of places where people aren't fully clear on what's about to happen. So while there's this high level of activism and engagement in the policy, there's also the reality that a lot of what this actually will mean for day-to-day lives is still abstract. And unfortunately, that makes the importance of certainty in this moment from state lawmakers that much more essential. If state lawmakers can be clear and certain about what is going to be done to protect families, that will go a long way to helping people who, as Morris said, people are what fuel our economy. Their well-being, their ability to engage in their communities, go to work, care for their families is what keeps our communities moving forward. If there's greater uncertainty for them, we risk hurting the broader economy and everyone in it. Thank you.
Thanks, Alexandra.
I'll
I
add
don't.
one extra point there because I
Okay,
think
go ahead.
I think it's really important. The reconciliation bill very intentionally delays some of the biggest harm. The benefits, right? The new tax cuts happen immediately. And again, to be clear, a lot of people won't even feel the impact of the tax cuts because there's really no change to what to their federal tax cuts from this year to next. But very intentionally, some of the biggest harm, including the first time requirement for states to pay a portion of SNAP benefits, come online later. And so it's going to be very important for all of us to not lose sight of the harm that is ahead, because even if it doesn't happen immediately, it will happen, right? Unless state lawmakers step up here. So I mean, if you look at the schedule of the implementation schedule of the reconciliation bill, it's all over the map when things come online. So just want to across that point.
Thanks, Meg. I'm also going to add that even though we might not know how many people know what's coming or how it will affect them, we do know to some degree what North Carolinians want. We did some polling last year, and I can include this in the follow-up email if you want, a lot of the numbers and everything. But we know that 77% of North Carolinians last year said that they reject the elimination of the corporate income tax, which is slated for 2030. And we know that 70% of North Carolinians in the poll said that they want to see a state budget that invests in education, infrastructure, and healthcare for the people, even if that means that the wealthy and profitable corporations have to pay more in taxes. So, and there's a lot of other numbers and things in that poll. And like I said, I'll include those numbers. But I just wanted to add that as well. Do we have any other questions? Okay. All right. Well, it looks like we don't have any other questions at this time, but like I said, when we send the follow-up email out, I will include ways for you to get in contact with any of the folks that you've heard here today, so that if you have follow-up questions that come up as you're doing your reporting, you are able to connect with folks who can answer your questions. I'll also include a recording of this. And like I said, I hope to do a transcript as well if technology works with me. But thank you all for being here today. Thank you to the speakers. Thank you to the reporters and media members who showed up. This is a very critical issue right now for North Carolinians. And, we need to make sure that our state lawmakers can come back with a plan that's going to mitigate the harms and everything that's going on with, what federal lawmakers have done. So. With that, I am going to close this out and hope that you have a good rest of the day. Thank you all.